Hi everyone, my name is Katie from San Francisco Health Insurance Agency, and today I'm going to show you how to walk through Medicare.gov and sign up for a Part D prescription drug plan. And this example specifically is video number 3, and it's going to show you how to look and shop for drugs that are slightly more expensive. There's a small video disclaimer that we do not sell or offer Part D prescription drug plans in our office, and we do not have information about your plans in your area. So if you have any questions or want to learn about all your options, please contact Medicare.gov or 1-800-MEDICARE to get all your information. Today's video is purely educational, simply a guide. Feel free to stop the video, follow along as if it's a tutorial, and let us know if you have any other questions after watching this video. So to sign up for Medicare.gov, you'll go to Medicare.gov, and this will be the landing page. If you do not yet have a login, you're going to click Login and create an account now. You will enter your Medicare number and your Part A start date. You can find your Part A effective date on your Medicare card, like here in the example on the right. It'll ask you for a little bit more information after that, just to verify who you are. You'll create a password and a username, and then you will log in as well to get to your Medicare dashboard. Now, I got written consent from Steve to use his account as an example for today's video, so I'm going to log in. And this is the Medicare dashboard. Open enrollment for your Part D prescription drug plan is October 15th to December 7th. And during this time, if you were previously enrolled in a drug plan for the year of 2022, then this plan change would take effect January 1st. It's important that you shop for your drug plan every year because the prices are pretty volatile. And if you add a new drug, it's important to make sure that you're on the most cost-effective drug plan in the way that it would be covered. To shop for your drug plans for 2023, we're going to start by clicking this hyperlink called View My Plans. Now, when you get here, you're going to go to the middle of the page to this light blue bubble and click Preview 2023 Plans. When you get to this page, you're going to scroll down and you're going to find Plans Now. You're going to enter your zip code, for example, 94941, and you're going to click Drug Plan Part D and click Apply. It's important to note that 2023 is selected here because this will show you the estimate from January to December instead of just the rest of 2022, which would be November and December. You're going to be shopping for 2023, and that's when your new plan would take effect. So you'll click Start, you'll click Yes, I want to see my drug costs when I compare plans, and then we are going to start adding drugs. So for this example, I'm just going to add atorvastatin, which is a generally pretty cheap drug. You can select the dosage here. If I take it once a day, it would be 30 for every month. Add to my drug list. Add another drug. Fill out all of the drugs that you take, the dosages to match. If you take it twice a day, you do 60 for every month. Now, let's say I take a more expensive drug like Eliquis. So I'm going to add that drug, select my tablet, I take it once a day, add to my drug list. And then another drug would be, for example, Humira. You're going to check Add Drug, and we're going to do a pen injector and a box of 1. We're going to get one every month. Every pack into 2, so every 2 months. So I have 1 injector every month. So these have kind of a combination of pretty cheap drugs and more expensive drugs. So once you're done adding drugs, you'll scroll to the bottom, Done adding drugs, and you're going to click Add Another Pharmacy. When you shop for a pharmacy, it's really important that you choose at least 4 of them. And the reason for that is because of big pharma and politics, drugs will actually cost different amounts sometimes from pharmacy to pharmacy. So for the sake of this exercise, even if you're loyal to a CVS that's down the road from you, make sure to click mail order and a couple other pharmacies that you would go to. So I'm going to click Safeway, CVS, Walgreens, and a Walgreens down the road from you is going to be the same Walgreens that you have in San Francisco or a Walgreens in a different part of the North Bay. Walgreens prices will be the same, so you don't have to find the exact one at the exact address that you're looking for. So once you get those pharmacies, you're going to click Done. And then you'll see on the top right that you're viewing 2023 plans. So this will give you the estimate for January 2023 to December 2023. And this top plan here is the plan that you have for 2022. So your current drug plan that you're enrolled in. It's important to note this, but it's very important that you scroll down. This is where the true search starts. You'll see that there's 26 different drug plans. And when we enter our drugs that we use and the pharmacies that we would consider going to, what Medicare.gov does, and it's almost a little magical, they run those drugs against all of the formularies for all the 26 drug plans. And it shoots out with their algorithm which one would be the most cost effective for you. So you'll see that we are sorted by lowest drug and premium cost, and that the monthly premium for this Clear Spring Health Premier PDP prescription drug plan has a yearly drug and premium cost of $5,184. And this is a kind of an all-in-one bundled price. It includes the monthly premium, it includes the cost that you would fork out when you go to the pharmacy to fill your prescription, and it includes if you hit your deductible. So this is how we were going to go and shop for the drug plan. This star rating, we don't know what it means, so we don't know if it's significant or not. If you scroll down, you'll see that it gets a little bit more expensive. So $52.73 with this other plan, and then it jumps significantly to $46,000. So it looks like these two plans would be your best bet in terms of getting your drugs covered. So if you click Plan Details, it'll show you that 4 out of your 4 drugs are covered. The monthly premium would be $15.10 a month, and they're estimating that for the entire year, when you go to the pharmacy, you would fork out $5,000.03. So if you scroll down, you'll see all the drugs and the cost that it would have per year. So you'll see that Humira is the most expensive. It's going to be the most expensive as a mail order. It's about $300 more. So is Eliquis. And this is why it's important to shop around in terms of where you go to pick up your drugs. Sometimes the retail pharmacies are going to have significant changes as well, not just the mail order. So it's always good to add multiple pharmacies in just for the sake of this exercise. If you scroll down, you'll see how much you would pay in the beginning of the year for every month, and you'll see that it would change because in the first month you would hit your deductible of $505, which means that you enter what's called a donut hole. So you don't pay any more than 25% of your covered drugs. So that's why it drops in February. Now it goes up again in March because you're out of that coverage gap, and then you pay a little bit more. Additionally, we said that we would collect Humira every 2 months, and so that's why every other month is going to be more expensive. Essentially, you're going to take on the bulk of the cost in the beginning of the year, and then it should even out. Now, $5,000 is quite a lot for drugs. That is non-negotiable. Steve likes to say, in terms of the context, a drug program is better than no drug program. And the reason why it's not stronger is because when they created the drug program for seniors, they didn't have enough funding. And so this was the way that they could spread out their funds, is different coverage areas where it's a certain price until you hit your deductible, a little bit lower, a little bit more, and then even lower the more money that you pay out. Now, these are the plans at the top that would be the most cost effective. There is not an enroll button right now. You'll see because it's not October 15th, you can't enroll yet, but there would be a big green enroll button here. When you're ready to enroll, you would click enroll, follow the pages, and follow it towards the end when you get the confirmation number. It's important to keep that handy just in case anything goes awry. You'll have that proof that you did sign up for a prescription drug plan. Hope this video was helpful. Leave us a comment or shoot us an email or give us a call if you have any other follow-up questions. Thanks.